Corla, I'm going to talk about the health budget, obviously, and this year's health budget is about more services for patients, faster access for patients, more capacity and urgent reform. The total health budget for next year is a record €25.8 billion, representing an increase of nearly €3 billion versus 2024. In addition to this extra €3 billion, over 900 million of one-off funding from previous years has now been agreed as recurrent funding, and new measures in this budget total €335 million. It's very welcome, it's much needed to provide care to a growing and ageing population, to roll out new and improved services, to reduce costs for patients, to increase the speed of access for patients, and to reform and modernise our health service. We have funding to hire more than 3,500 more healthcare workers, and given that there are currently about 3,000 vacant funded posts in the HSE, it means that between now and the end of next year, the HSE is now funded to hire an additional 6,500 healthcare workers. We're funding to open another 335 hospital beds and 615 community beds to expand services for patients in many different and important areas. This includes cancer care, women's health care, trauma, dementia, maternity, palliative care, rare diseases, cardiovascular, stroke, neurology, organ donation, genetics and more. In Budget 2025, one big area we're focusing on is cancer care. I've allocated an additional €33 million to cancer care, which is a full year allocation of €46 million. That's €10 million for cancer medications. It's €2 million for post-mastectomy products. It's nearly €2 million for bowel screening. It's about €16 million for the National Cancer Strategy, with a full year allocation against that of €22 million. And critically, as part of that, there's a full €5.5 million in recurrent funding for all of the amazing cancer support groups we have, Ceann Comhairle, in all of our constituencies. And I know they've really welcomed that funding. This will be the fifth budget in a row where we've prioritised women's healthcare. We're investing an additional €35 million. HRT medication will be provided free of charge from January. Eligibility for free IVF will be extended. It's going to include donor-assisted IVF, as well as for couples who already have one child. I'm investing €30 million in new medicines, coming from targeted savings within the medicines budget. Waiting times, we know, remain too long, but important progress is being made. The average outpatient waiting time has now fallen from over 13 months to just over 7 months in the last 3 years. That's nearly a 50% reduction in average waiting times, and I really want to commend our healthcare workers all over Ireland. It's an extraordinary achievement that they have provided. I know it has taken huge effort, blood, sweat and tears, long days, weekends, but to have halved the waiting time in this country in just 3 years is remarkable, and I salute them for having done it. We're investing €420 million in waiting lists next year. That's an increase on last year. It includes €230 million in funding for the NTPF and €190 million for the HSE to continue a lot of the work they're doing on reducing waiting times. And critically, Ceann Comhairle, in moving this funding from one-off funding, where it was very valuable and well used by our healthcare workers, but it was uncertain. That has now become recurrent funding. So not only can they drive on, they can plan for years into the future. It's very, very welcome. We're also opening 6 new surgical hubs, which is going to make a difference. This is the second year in a row that the number of people on trolleys is going to fall, but we know that we still have a long way to go. In this budget, we're staffing 6 new injury units around the country and funding expansions for 5 emergency departments. We've been working hard to increase services that pharmacies can provide as well. We've passed new legislation, and the expert group has reported on things like prescription extensions, common conditions. It's going to really bring in a new era of community pharmacy in our country. To that end, Ceann Comhairle, I'm allocating €25 million for next year, critically with the full year allocation of €50 million, and that's to facilitate now an agreement between my department and the Irish Pharmacy Union. There have been preliminary talks going on for a time, so we're putting €50 million on the table so that my officials and the Irish Pharmacy Union can get into formal talks now about delivering what's needed in our communities. There is no doubt but that we have a lot more to do to improve productivity. While we have and we continue to invest very significantly in our workforce, in our bed capacity, in other infrastructure, we must, as a matter of urgency, modernise how that care is delivered. A lot of progress has been made over the last few years, but more is required. We must have a highly productive health service. It means the maximum amount of care for patients and the best value for taxpayers. I'm allocating dedicated funding to developing advanced practice for health and social care professionals. I'm progressing the role of physician assistant and funding training courses for operating theatre assistants, so 2 new roles that we're bringing in. Critically, I'm allocating 23 million in recurrent funding for our new e-health strategy. We're going to have the patient app at the end of this year, shared care records at the end of next year, and we're now building up a big team, several hundred strong, to deliver our e-health ambitions over the coming years. Ceann Comhairle, waiting times are falling, trolley numbers are falling, costs for patients are falling, but we have more to do. I think we're about halfway through our journey to deliver our country the healthcare service that it deserves. This budget, Budget 2025, is another important step on that journey. Gura Magat.